So yesterday I was asked, I think it was yesterday, to review findings, a report on someone's ultrasound. This ultrasound was really looking at the kidneys, bladder, and the prostate. So I'm not looking at the findings. I think I put them up. I will put them up as a screenshot. I'm going to try to do this off of memory. The um, the kidneys were relatively fine. The only abnormalities were two stones. There was a 7 millimeter and an 8 millimeter, I believe, one in each kidney, or a 7 millimeter in one kidney, 8 millimeter in the other. Those are sizable enough to be concerning because while right now they're not blocking the ureters, they could. And an individual trying to pass those, they're not likely going to be passable on their own because of their size. So, I recommend to go back to the urologist, request lithotripsy. They'll break up the stones, you pass them on your own, and you're good to go. Looking at the bladder, again, no tissue abnormalities outside of the two artifacts that were discovered. These artifacts could mean a number of things when we talk about an ultrasound. It could mean there's debris that these waves are bouncing off of and reflecting back. And so you see like bright spots, for example. It could be just something that's not supposed to be there, right? Or it could be stones. These could be stones as well. Given this patient's history, it's probable that's what it is. Uh, they had symptoms earlier that suggest they had stones that had moved through the ureters and are now probably, they hadn't passed them yet. So it's possible that that's what it is. Otherwise, bladder health is fine. So we look at, or at least based on this ultrasound, there's no other abnormalities. We get to the serious problem that I see is the prostate. The prostate is 120 milliliters. That's like 4 times the size of a normal prostate. So what do you do with that information? You say, okay, what else do we know? There's no signs right now of cancer, so that's good. But the individual is also asymptomatic of what we would call BPH, which is benign prostate hyperplasia or enlarged prostate. So you have to deal with this before it becomes a bigger problem. This is not one of those things where you say, well, we know you've got this, but until you have problems, we won't deal with it. This is something that now has gotten to the size of you need to deal with it. So I put my recommendation as far as his treatment goes, what I think you should go back to the urologist and request. You guys can certainly comment or send me DMs if you got questions. But at the end of the day, a prostate that size could lead to renal issues upstream, and including that hydronephrosis we mentioned earlier. So that's my quick down and dirty.